let us come to the risk factors one by one. It will be easier if you read that way. What are the questions they ask you from smoking? So number one, smoking increases the risk of bladder cancer by 2 to 4 times. This is something that they're not going to ask because everybody knows this. What they're going to ask you, if the patient stops smoking, what is the risk of the patient coming back to normal? Okay, so it takes around 20 to 25 years to become the relative risk becoming one again.
Mm-hmm.
This is one question they ask. The next question that we've already discussed is about the acetylation. Okay, detoxification is slow, more chances of carcinogenesis. Okay. Now
Yeah.
coming to there was one more option on bilharziasis and squamous cell carcinoma. Okay, so this is another sentence straight from the Oxford textbook. 75% of these squamous cell carcinomas are associated with bilharziasis. Okay, the
Mm-hmm.
rest we will discuss. We have a discussion on squamous cell carcinoma later on. But for the time being, just understand squamous cell carcinoma, 75% are associated with bilharziasis. Around 5 to 10% are associated with chronic catheterization and other causes like stones and all. So the most important you said was correct, but the percentages they are very fond of asking. So any
Yeah.
percentage given in Oxford is going to be an exam question. So we are trying to compile them together along with the
Mm-hmm.
relevant questions so that we have a long lasting memory of these percentages.
Yeah.
Okay. So 75%, coming back to this question, this is wrong. This is
Mm-hmm.
75%. Okay. Because that's what Oxford says. Methotrexate, no. Okay, coming to the drugs in bladder cancer. So when it comes to the bladder cancer, what are the drugs? It's not azathioprine, it's not methotrexate. Both options are ruled out. When it comes to bladder cancer, there are three drugs that you have to remember. One is a
Mm-hmm.
cyclophosphamide that we have already discussed in the last question. It's simple. Cyclophosphamide. Number two is the uh, anti-diabetic drug, pioglitazone.
Mm-hmm.
Pioglitazone. It's a very favorite question. Uh, if you talk to the candidates who appeared for the section 2 yesterday, some of them were even asked about this in the section 2, which anti-diabetic medication causes bladder cancer. Okay, so even
Mm-hmm.
in the viva this is being asked, pioglitazone. And the third drug is the phenacetin. You will read phenacetin again as a risk factor when you talk about the upper tract urothelial carcinoma. Okay, so these three drugs are the risk factors. Apart from this, whatever drug they give you in the exam, just rule out easily. Confidently rule them out. They are not your answers. Okay, azathioprine is not a risk factor. Methotrexate is not. Only the risks for drugs causing risks are the cyclophosphamide, pioglitazone, and phenacetin. Okay, smoking, we know about the smoking. We know about the drugs. We know about the occupation. Now, just quickly coming to the most common occupation is the rubber and the paint industries. Okay, both produce this aromatic hydrocarbons and aniline. So that is why they are the most common occupations. Okay, now there are some rare things which you don't find in any other books commonly, neither in the European guidelines, but they can be asked. What are the other risk factors for a bladder cancer? We don't expect a Crohn's disease to come into our mind very easily. Neither do we expect obesity or a renal transplant. See, renal transplant is a risk factor, most of us know. But coming to the CRO, we need to remember this, okay? 2 times, 3 times, and 2 to 3 times. Crohn's disease, renal transplant, obesity, 2 times increased risk, 3 times increased risk, and 2 to 3 times increased risk. Try to remember this. You can definitely get an MCQ in your section 1 from the risk factors of your bladder cancer. Be confident, try to confidently rule out. So if we again come back to this, we can rule out easily option C, option D, option E, and option A. Now only left is your option B, aniline. And definitely aniline is important because it has been given in images in your